You ready? Good afternoon. My name is Tim Killian, Killian. I'm a public information liaison with Care Center of Kirkland. I'm here to do our daily 1 p.m. briefing, which we will continue to do every day at 1 p.m. As long as we feel it is necessary to update new and emerging information. I'll start again with the numbers, which is what we do every day. I then have questions from yesterday that I'll be able to answer as well, and then we'll open it up for questions after that. As of Monday, March 9th, again, as of February 19th, we had 120 residents. We now have 60 who have transferred to hospitals. That's an increase of 2 from yesterday. Our death number has not changed. Patients who have died in hospital that has been reported back to us is 15, 13 of which tested positive for COVID-19. Patients who have died in our facility, 11. We continue to have no information on post-mortem tests of those patients that died in facility. The current number of residents is 53, which is a decrease of 2 from yesterday. Current number of residents with COVID-19 symptoms is 7, which is an increase of 1 from yesterday. And I should say that number, for example, yesterday that number didn't change, but it could be that somebody stopped exhibiting symptoms and another person was added. So this is a fluid number that doesn't necessarily correlate to the same patients every day. All tests of in-house residents have been completed. We have received 0 official test results back from the University of Washington testing facility. We hope to get those quickly. We keep calling them and we are in contact. I will say we've had 1 positive test reported back to us, not through official channels, but through essentially a family member reporting to us that their family member had tested positive through our test, but we have not had official confirmation of that. The total number of residents with a positive test result, most of these in hospital now, is 20. That's an increase of 1 from yesterday. Employees, we started with 180. As of yesterday, following Department of Health guidelines and CDC guidelines, those employees have been self-sequestering in home. 5 of those have now returned back to work. 5 of those, following the guidelines that we've been given, have been able to then come back and begin working again. So that number right now of employees showing symptoms is 65. On the back of the sheet, I added an addendum. There's a conversation that we started having a couple of days ago, and actually this relates to why we chose February 19th as our start date. And I want to clarify this because it's created some confusion. We chose February 19th because that, if we go back in time, that was the first resident that transferred out of our facility and later tested positive. Some confusion has arisen thinking that we knew at that point that they were positive. We did not know. It wasn't until February 29th or 12:30 a.m. in the morning that we got our first notification that we'd had a resident test positive. That test came off of a resident who left on the 24th of February. So it's only been, so today I think is day 10 that we knew that we had COVID-19 within the facility. And so there's been some confusion that we perhaps knew clear back as early as February 19th. We did not know. At that time we did have a respiratory illness outbreak, and we had no medical reasons to suspect that it was anything other than that at that point. So that's just a clarification. There are questions from yesterday that I believe, one question I'll get to right off the bat. There was a question about waste disposal here. We continue to be serviced by Waste Management. They reached out to me yesterday and expressed to me that King County Solid Waste Division has a set of guidelines that they've put out. It's published on their website. Waste Management is in communication with King County Solid Waste and says that they are complying with the protocols established by King County Solid Waste. And I would just direct any questions about those issues to King County Solid Waste. Waste management does not deal with our medical waste. That's a separate company. We continue to follow all regular protocols regarding medical waste within the facility. There continue to be questions about communication with family members. We feel more and more confident that we have that better under control. We now have a doctor on site in facility who is in direct communication on a regular basis with family members. They are able to call and communicate with him. We have increased nursing staff and social work. As I said, we've started to up the numbers with the strike teams that have come in. It has given us a little bit more breathing room. We recognize the frustration that these family members are experiencing, and it's completely understandable. But I also want to communicate that we do feel like our ability to communicate back with those families is improving. Again, if any family members have questions, they are able to call. They can ask for the doctor who is specifically tasked now with speaking with family members directly. Related to that issue, as we've received increased staffing and staff returning back to work, we also feel like we're getting back on a regular schedule, things like bathings, issues such as that. The flip side of that is, as we get even more regular with our interaction with the patients on a normal basis, we are seeing other issues and symptoms that we're having to deal with. So it's we gain in one area, but then learn other things that we have to do in addition. There was questions about the HVAC system. None of the rooms have ventilation systems that vent back into the building or into other rooms. The only thing they have are ceiling fans within the bathroom, but those vent directly outside. Any HVAC systems that we have within the building are for common corridors, and those do not vent back into the bedrooms either. So in the rooms we have electric heaters, coil heaters that have no air intake. We have the bathroom fans in the bathrooms, and we have windows, but none of those are connected room to room. In terms of the strike team and how many that is, so on average there are 3 shifts a day. In each of those shifts, on average, we have an additional 1 to 2 doctors, approximately 2 nurse practitioners, and approximately 6 nurses that come in on each of the 3 shifts throughout the day. That's in addition to our own staff. We still do not have specific kits to test our staff. There was a question whether or not other patients had been admitted to the facility after we discovered that we had COVID-19 symptoms within the facility. We had additional residents come in that time frame between the 19th when that first patient went out and the 29th when we found out that we did have a positive test here. But since that point, no new residents who hadn't already been here have been admitted to the facility. There's a question about family members being able to visit. We strongly discourage it. That becomes an individual conversation with each family member as they're communicating with the doctors, and if we need to accommodate in some way, those are being handled on a case-by-case basis. But generally, as we've said before, all non-essential staff and other visitors are being turned away at the door. If there are exceptions, they would be for extraordinary circumstances and be coordinated with the staff and with the doctors on site. There's a question about kindness from the community. We continue to be grateful for the support that we're receiving from. I don't have any specific numbers on that, but that is happening, and we are grateful for that outreach and the positive treatment that we are receiving from local community. And that's all I have. I'll open up for questions.
Can you tell us about the person that was transported a little bit earlier today? Do we have any information on that?
Oh, thanks for asking. Yes, this was a transfer to hospital due to symptoms. So, and that number is not reflected on this sheet. So we need to, that's a +1 on that number of patient or residents who've been transferred. That was an additional transfer today.
What's being done to figure out how this virus got introduced to this facility, and are we any closer to learning that answer?
That falls in the realm of the CDC and other government agencies. We personally are not we don't have the manpower nor the time at this point to be focused on that, but I do believe that that's an ongoing research of the CDC.
Have any of your caregivers passed I know that some have returned to work, but we don't know, we can't account for everybody. Did anybody who's been a caregiver here, has anybody died?
I have no information that anyone has. Our belief is nobody has. It's a good time to reiterate, part of the difficulty of these numbers is the hospitals aren't necessarily communicating back with us exactly what happens with each patient when it happens. So for example, yesterday there was a report of 2 additional deaths. We still don't know exactly who those deaths were or if they're already in our numbers. We've been calling. The patients are spread throughout multiple hospitals. Some hospitals respond faster than others, but like us, they also are overwhelmed with the influx of patients. So we continue to call, and we'll update those numbers as we get confirmation, but we don't have any information that any employees have passed away.
Just to clarify, that patient are you getting about the employees? Why the employees aren't being tested? What are you being told?
I don't have a specific statement as to why that hasn't happened. We continue to ask for support in that regard.
Who are you asking?
We ask the various government agencies that have been supplying us with test kits.
And what are they telling you?
I don't have the specific word. I can't speak for them. We don't have an official statement from them.
Are the
Can
patients
you tell us what you're asking them? Like right now, we need X, Y, and Z. What is your demand to help test your employees?
Yeah, that's what we are asking. We would like more kits to be able to test employees.
And weigh in on that. I mean, how do you feel about that?
We would like more kits to be able to test employees. That's what we continue to ask, and we hope that request will come through.
Why is it taking so long?
I don't have that answer.
Are you getting any answers from them? Have they said we're sending them, or have they said we don't have enough, or they've given you any indication as to why they haven't been able to get you tests?
And just so you know, as I mentioned, I'm considered a non-essential employee, so I don't even get to go into the facility and speak directly sometimes with the staff who are on phone with them. And sometimes the best I get is they still have not delivered for us. So I've never been on those phone calls and can't speak directly to what information is being conveyed.
What's the status of the residents who don't have any symptoms? Are they allowed to leave if they wanted to?
Again, a lot of these, I shouldn't say all, but I believe that all residents do have the freedom if their family members feel they could be better treated in another location. The problem is a lot of these residents have medical conditions that need specified treatment that family members would be unable to provide if they weren't here. So while they have that ability, there are not other locations that are willing to either take those patients, or the families do not have the capability to treat those patients within their own homes.
Can you give us a sense of what it's like inside? Are you hearing from the folks inside how they're dealing with the staff shortage, for example? How are things going inside of the facility now?
I have to say that today there is a sense that we are moving into a better phase of this. The nurses seem buoyed by the additional staff help that we've received. They do feel like they're able to get back to some level of normality in the way they're treating and for example, as I said earlier, bathing patients. We do feel like that is starting to stabilize and that we're starting to be able to return to a normal level of care.
How many days
Do
do people
the 5 employees that have returned from that self-quarantine, what are they saying? How are they?
I have not. I just got that number about an hour ago, so I have not had a chance to speak with them.
And so
Tim, can you talk about
Employees are no longer in the facility.
Talk about the risk of patients still, because we're still seeing the deaths climb, and we're up to 19,000.
As I would say, we started testing on Friday. As of just now, we still do not have any test results spoken back to us. So we don't know what still exists within our facility of patients who will test positive or won't test positive.
How did you learn about the first positive COVID tests?
That was communicated back to us from a hospital.
When was that?
That was on the 29th of February.
That was the first one.
Correct.
And when did you guys shut down the facility?
Well, it was at 12:30 a.m. is when we received that phone call on the 29th. And it was at that point we went into the procedures that led to that shutdown. I don't have, I believe it was that same day. I don't have the exact time or what the sequence.
And when did you stop the visiting?
I'll get that exact. I'll get that exact date.
Point of clarity.
I think from the beginning, what we did do is we were in contact with government agencies and following their recommendations on how we do it. But I don't have a time, but I'll try and get that exact time.
Let me go back to employees for just a second.
Uh-huh.
So if 65 are showing symptoms are no longer at the facility, does that mean 115 are working on shifts in and out of here?
Correct. We start with 180. You subtract that out. They're not all here at once. It is shifts. A lot of them, though, still, for example, I just spoke to a nurse who has been working 18-hour days since this started. She says she gets 3 to 4 hours of sleep a night. Sometimes that's here. Sometimes she does have the ability to leave. But that's what it's been like working within this facility for the last 10 days.
And I also want to be clear that those 115 people, they're coming in contact with people with symptoms with COVID-19, and therefore they would qualify for the protocol for testing.
As I say, we continue to ask for support in testing even our employees.
Are all 115 coming in contact since they are working in the facility, or are they in areas
There's different levels of interaction. Some of them, not all of them are going into patient rooms. Some of them have different duties that don't take them into patient rooms.
Just to clarify, sir, that patient that was taken away by ambulance, based on what you've said before, safe to assume they were exhibiting acute COVID-19 symptoms?
That is my understanding, yes.
Can you speak to one of the first responders has spoken to CNN from last week when they came into the facility and said they only saw about 3 staffers for 90 patients?
Thanks for bringing that up. To the best of our understanding, that EMT, I believe it was, came middle of the night. Our nursing staff would have been in rooms dealing with patients. To the best of our understanding, that person did not see the full extent of what was happening within the facility. In the middle of the night, one, it's a lower staffing time anyway, but a large number of our employees would have been in rooms treating and taking care of patients, and they wouldn't have been immediately visible to anybody who walks in. And so I think there's some confusion about what they saw compared to what was actually going on within the facility.
You said you're getting back on schedule with bathing schedules. How many days did people go without bathing? We talked to a family that gave us a number.
I don't have a specific number, and it would be different for every patient depending on their needs. As we've said, our need to focus on other things overrode our need to follow regular schedules such as bathing. It wasn't that we stopped caring for the patients, it's just that our focus and the decreased number of staff caused us to have to alter the normal routines. But that may be different for different patients with different needs and different care guidelines.
Have any of the 65 employees been tested that are self-sequestering at home?
We have heard that 3 have tested positive. Let me rephrase. We have 3 of those employees who are hospitalized and I believe did test positive. Again, once they're out of our facility, we don't always get an immediate notification as to what their status is.
Those 3 have been tested positive? Yesterday was 1.
Let me clarify that. I know they're hospitalized. I think you're right. We did say 1 yesterday, but I don't have an update. So if that's what I said yesterday, that's what it would be still.
So how do employees protect themselves when they interact with?
They're all trained in infectious disease. They wear PPE, what's called personal protective equipment. In fact, we were just talking about, you can see, we have been receiving the supplies. We still have enough, thankfully, of supplies for personal protective equipment. Again, we're following CDC guidelines in protecting our employees within the facility, and they're all following those guidelines.
Tim, we were told by some family members that before you got the positive COVID test result, some staff were wearing masks. Did you guys suspect something was going on?
We're winter. Influenza outbreaks are common. We did have some respiratory illnesses going on in the facility, and so this would have been normal protocol for our employees already, independent of any COVID-19 results. So that would be normal protocol to begin with.
Did you all report that to the public health department?
I can't speak directly to that. I can see if that's I'm sure we are in touch, but I can't speak to a direct conversation. Anyone else?
Do you have any indication when the testing will come back? What have you been told? Anticipated today?
We're hopeful.
Tomorrow?
We're hopeful as soon as possible.
Are you going to be testing those people who have passed away? There was some question by a couple of families wondering if their person who died were being tested.
It's not our decision. We keep asking for any post-mortem tests that have been done, but nothing has been reported back to us.
Would that be at the, where would you take those samples from the morgue? Or
They would. They're split into different areas, I believe. So again, I can't speak to where they're all at or who might be responsible for that testing.
Tim, that one detail about when you actually stopped the visiting would be really useful to have. I don't know if you could put that out
Sure.
in an email today. Or...
I'll try and do an addendum later tonight.
Great.
Okay.
Thanks.
Of the people that have died and tested positive for COVID-19, have they all died at Evergreen? You've had 15 patients die.
I don't know what the breakout is. I don't believe it's all at Evergreen. And again, communicating that once it gets split to different hospitals and they have different reporting guidelines, it's hard for me to give an exact breakout of that.
Okay.
And we also heard there was a visitor who died. Is that in these numbers? Or?
That is not in these numbers. I have not independently confirmed that. I'll see if I can get more information on that. I heard that as well, but I haven't independently confirmed that.
Any update on whether you guys shared vendors or performers or even clergy that might come in to deliver ashes or something with any other nursing homes or facilities? Have you guys reached out, gone through your logs and reached out to anybody on this, like the firefighters have done?
I don't have any specific information on what may have been done to reach out and verify what came in or out.
Do you keep logs of visitors?
I will ask and get an update.
Great.
Yesterday you mentioned some concern about PPE supplies. Has there been any update on that?
Yeah, as I said, these are all new PPE supplies that we've been receiving. As of today, we're fine with PPE supplies. We do worry about, as this increases throughout the community, that will become more and more difficult.
Can you tell me how much staff is there? I mean, obviously the CDC has also sent some people in. Is that still the case? And is the staff to full capacity?
I would not say that we're not at full capacity, but we are doing much better than we were.
Can you send some numbers?
I don't have a specific number because it breaks out into shifts as well. And for example, some employees who are not nurses may not be on all shifts, and so it's not a specific number.
Do you have a number of who all is here from the CDC?
As I said, so on average, it's 3 shifts a day. We get 1 to 2 doctors, a couple of nurses assistants, and 6 or 7 nurses per shift.
Tim, is there, in addition to getting kits for the employees, what else does Life Care Center need? You have the ears of so many. What do you guys need?
I think making sure, I mean, the kits are the number one thing. Test results are weighing on us. That's something we would really like to see. Making sure that the pipeline for supplies, even beyond the PPEs, would be important for us. And then I think other than that, we are hitting, I don't want to say normal, but we are normalizing a bit today. There does feel like we have lost employees, but we've also lost a number of residents, right? So the number of residents has lessened as we've started receiving back employees and received help from outside agencies. So
what are you doing for sort of the well-being of the employees and their mindset in dealing with this? All they're under a microscope, so to speak, and I'm curious about mental health and attitude and
I'll try and get a sense of that and do an update on that tomorrow.
What can you tell me about well-being?
I can't speak to it directly.
Tim, about earlier this week you expressed, made clear that there was no guarantee that COVID wouldn't spread in the facility. And given all the measures you've taken now, is that still the case? Do you still feel that it could spread?
Again, what I said a few days ago, that we have found this virus to be unpredictable. We're still learning. There are things that we don't know. For example, how long the virus stays active on a surface. That's still not something that we have a strong grasp on. So there's no way we can say with any level of guarantee that there's not further infection spreading. And until we get the test results of the existing residents, we certainly can't speak to what is or is not happening still in the facility.
Well, do you have advice for other nursing facilities? We're seeing that spread to other facilities, and wondering, since you guys have gone through this suddenly and quickly, do you have any thoughts for that?
I think because we don't yet know what the level of positive is that is still within the facility, it's hard for us to say that what we've been doing has worked.
Yeah.
Once we get those numbers, then we may start to have a better understanding as we correlate test results with various patients and various levels of care that they've been receiving and how we've treated them. Again, I think that information will probably come in the later days as we're able to talk amongst ourselves and discuss what we have and haven't done and what has or hasn't worked.
Did you get any word why it took 10 days for the first patient's test results to come back? How long?
As I said, testing has been out of our control, and we have not been. No, I mean the short answer is no, we don't have a sense of what took. And it wasn't 10 days. The first test came back 5 days after that patient. It was then a retroactive testing of another patient who had come from our facility.
Can you walk us through, and you've probably done this over and over again, so I apologize, but what's going to be the protocol when those test kits come back and you find out X amount may be positive? What happens to those patients? What are the next steps?
That'll be in discussion, I'm sure, with the CDC and other government agencies on how they would like us to handle positive patients who are asymptomatic, those who are not showing symptoms at this point. Whether or not they feel it's best to keep them sequestered on site or move them to hospitals, that decision has not been made.
So how does that sit with you that you don't even know yet? You could get those results today, and then what we're going to ask then what we do?
All I can say is we continue to wait for the tests. I'm sure a lot of this has to do with how large that number is, how many people test positive. So I'm not saying that there's not a plan in place. I personally have not been made aware of what that will be. I can ask and report back on that tomorrow.
Is it possible to email us that today?
If it's something that's worth noting to the group, I will certainly do that.
Thank you.
And thank you. With employees coming and going, what's the level of confidence with all the unknowns you mentioned that they themselves aren't causing further community spread?
All I can say is that these employees are following the guidelines for safety that we have in place, that we've had in place for influenzas and things, and following further guidelines that the CDC has given us. So we're relying on that guidance from the CDC. I will say that the 5 who came, it's been expressed to me that the 5 employees who came back were anxious to come back and help. So again, heroes within this facility, running into the fire, as it were, and as a non-essential employee, as I said before, if the newsroom were infected, I'm wondering how many of you would be running into the newsroom every day. But these employees have been trained, and it's what they do is they take care of patients, and they recognize that these patients are members of families of people who are wanting more information, and I can say they're treating them with care and dignity and with the professionalism that they've been trained to give. So with that, that's it for today. As I said, if there's any addendums that I can put out later tonight, I will do so on the general distribution list. That's press@lcca.com. Thank you.
Thanks a lot.
Thank you.